This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. Somebody's asked me, what do I think is better, a fresh or a frozen embryo transfer? If you'd asked me this question a decade ago, I would have said there's no question. Fresh is at least 50% better in terms of pregnancy rates. But that was because of the freezing techniques we used in those days. A decade on, the newer technique called vitrification has changed the face of frozen embryo transfers. And the evidence is quite clear. There was a very large Asian randomized controlled trial just published recently, which showed that fresh is exactly the same as frozen in success rate. If I have to freeze embryos because of potential overstimulation or because the hormone levels are wrong around the time of the egg collection, or someone wants to do genetic testing on the embryo, they're the situations where we would deliberately freeze embryos. I'm not fussed by that at all, because I know that frozen embryo is going to do well as the fresh one. People did wonder why this was so good, given that freezing and thawing is a pretty dramatic process for an embryo. It goes through, what they do first is to get rid of all the fluid inside the embryo. It's a bit like putting it on very intense blotting paper and sucking all the fluid out. And that's to stop icicles forming inside the cell, which then potentially damage the structures inside the cells. Once that's happened, it's then put into liquid nitrogen at minus 70 degrees, which again is fairly dramatic. And then when we thaw it, that's a more gradual process of them coming back to room temperature and the cells expanding and reabsorbing the fluid. So it's amazing that an embryo that's hammered like that can do as well as they do, but they do. The success is thought to be in part perhaps because the lining of the womb in a frozen cycle, that lining is a natural lining. It hasn't been affected by the large levels of hormones that you get in a fresh cycle. We think there might be a balance between that a bad embryo might do okay, would do better with a better lining, compared in a fresh cycle where you may have a better embryo, but the lining of the womb is not as good. There's a balance in there. That's what we think anyway. But whatever it is, the success rates are very similar. So I don't have a favourite either way. There are clinics in Australia who have very good success rates who only do frozen embryo transfers. They stimulate strongly. They therefore have more embryos to transfer. They freeze them, and then they can select the day on which they're going to put them back, because they then use hormone replacement to actually select the day. So in terms of convenience for you and the doctor, frozen embryos do have some advantages. And the success rates appear to be as good as fresh.
Prof, we have a question from Amanda. She says, being 40, if I do IVF, should I be getting all the embryos PGD tested? Can this also damage them?
Given, I'm presuming Amanda's the same lady that's had 4 early miscarriages. If that's the case, then certainly I would be doing PGT. If you're going to go to IVF in that scenario, then doing PGT is a good idea. At 40, I said earlier that 95 to 98% of embryos will be genetically abnormal. At 40, 70% will be genetically abnormal. So if you get 10 embryos, if you're lucky enough to get 10 embryos, 7 of them are going to be genetically abnormal, 3 will be normal. So putting back a normal embryo, knowing that you're putting back a normal embryo, has an advantage. Now, it may be that at 40 you only get 1 or 2 embryos, and there's a debate there as whether it's worth testing them or not. I certainly, at 3 embryos at a woman in 40, I would definitely say test them, because testing them means you're probably saving money on a frozen embryo cycle, but also the pain of one cycle after another where you don't get pregnant because they're genetically normal. And if you think those numbers through, it means that if you only got 3 embryos, there's something like a 15 to 20% chance you get no embryos that are normal. Now, that's disappointing, but at least you don't have to go through the psychological pain of putting an embryo back and wondering whether you're going to get pregnant or not. we just wouldn't put the embryos back. So yes, there are advantages. Doing the testing does have its risks. First of all, there's that freeze and thawing that I just talked about. But secondly, when we actually take the cells from the embryo, there's about a 2% chance of losing an embryo. It's not high, but there is a risk of that. Again, if you've only got one embryo, I probably wouldn't bother, and we'd just see what nature did. 2, it's debatable. 3, definitely do the genetic testing. That's my standard advice to patients.
And don't forget that you can access all the previous episodes by going to our website, www.theivfjourney.com, and select IVF Journey Podcast from the navigation menu.